y'all. It's great to be with you today. I hope we have a great discussion and talk about discovering your leadership style, something I am very much still discovering, and we will talk about that as well. I have no disclosures, and here are some learning objectives that I have for you. The first is I want you to understand some of the characteristics, actions, and skills of successful leaders. Identify some common leadership styles and which ones you most relate to. I want you to discover areas of strength and areas where you can improve. And then identify some leadership principles that you can apply to any leadership style. You've all gotten a handout and a pen. I'm going to ask you to just, I know we're all goal-oriented people who, when you have something in front of you, you want to fill it out, but if you could just hold on, we'll get to that a little bit later on, and no problem if you've already started. A little bit about myself, he kind of mentioned, and I know somebody's here from Chow. I was actually previously the president of Chow back when I was in medical school. Also did the resident executive committee early on in residency. But I'm going to start with this quote. Leadership and learning are indispensable to each other. This is a quote by JFK, and I have found it to be incredibly true in my journey and in this journey that I'm still on. I was the internal medicine and pediatrics chief resident starting in 2020. And so I was part of the leadership team that transitioned all of our recruitment from in-person to on Zoom, which it still is now. And we have recruited some of the best classes. We've had the highest list to rank match that we've had in years. And that was a team effort, but that was something I had to learn as I was doing it. I then was the internal medicine chief resident. I did that year because I really wanted to learn and develop some administrative skills that I just didn't feel like I had learned yet. And we'll have some stories from that later. And now, a year and a half out of, I guess 2.5 years if you count my internal medicine chief year, out of residency, I am one of 2 medical directors at Church Health Center. And I can tell you that is a steep learning curve. You deal with some budgetary stuff as a chief resident, but nothing quite like owning the budget for the medical clinic. And so I am learning as I lead, and I hope to inspire you all to do so as well. So you already lead. That's the good news. And one of the things that we're going to do, and I apologize, my poll everywhere didn't want to play nicely with PowerPoint. So if you could join poll everywhere, or you can text Melissa Barnhart 434 to that number, and you'll be able to participate in the poll. I want to hear about some of the exciting ways that you all are leading. So if you wouldn't mind, just send the title of your leadership position or something that you're proud of, something you've done in the past. And you can go back to high school. If you were the swim team captain, like throw it up there. This is really just a way to share some of the leadership positions that you have held. I know it takes a second. Have y'all shared? I want to make sure it's working because me and technology don't always agree. Yay, there we go, curriculum development, awesome. Co-president, right? Rec, awesome. Admissions committee, great. As these get mixed up, I don't know what word goes with what because there's a lot of two-word leadership positions, but y'all are amazing. And part of the process for getting to where you are today, becoming a doctor, selects for these leadership traits. It selects for people who stand up and take on these leadership roles. And so you are already doing this, and I just want to point that out and congratulate you on it. Okay. Here are some characteristics of a successful leader. The first is authenticity. If you are putting out who you want to be to the world instead of who you are to the world, people will pick up on that. And that doesn't build trust. It doesn't foster people wanting to be real with you. And competence is important, but authenticity is what helps people be drawn to you and want to follow you. Being curious is also really important. If you're constantly saying my way is the right way, you aren't going to have many people follow you for a long period of time. Being curious about other ways of doing things and other ideas will also foster that within your team, which is really important. Having an analytical mindset. And again, these are characteristics of successful leaders. And I say this at this point because my mindset is not always analytical, and it's something I'm having to grow and develop. But being able to analyze data, being able to apply that to your situation is incredibly important. Being creative. You may not be the most creative person in the room, but fostering an environment where creativity can flourish and those with that predilection can thrive will also help you in your leadership. Resilience. When things don't go the way that you plan for them to go, which happens more often than you would like sometimes, being able to bounce back from that and say, what can I learn from this situation? What do I need to know to do better next time? Instead of wallowing in that and saying, this didn't go right, I'm to blame, I did this wrong. If you get stuck in that rut, your ability to bounce back and continue to lead will be impaired. Empathy. You have to care about the people on your team if you want them to care about the work that you're doing. People who feel supported and cared for are going to do a lot more than those that feel that they just have to do it because they're there for a paycheck. And that starts with empathy. Integrity, doing the right thing. We'll come back to that a little later when we talk about the difference between leaders and managers. But you have to not only do good work, but you have to do right work. And then be adaptable and flexible. This kind of ties in with resilience. Resilience is when you have failed. Adaptability and flexibility is before that point. Can you pivot? Can you make changes? Or are you so set on your one right way that you're unable to flex and change as the situation requires? Some actions of successful leaders: clear communication and expectations. If you're just saying, hey, I'll give an example. I want to start treating Hep C in our clinic. Cool. Nobody's going to take responsibility for that unless you lay out clear expectations. I had to go to my nursing manager and say, hey, we're going to do Hep C treatment in our clinic. These are the guidelines we're using. I need you to come up with materials for the nurses to instruct patients on, and I need it in 2 weeks. Do you see the difference? It gives her ownership and responsibility, and it also accomplishes the goal of getting Hep C treatment in our outpatient center. Delegate as appropriate, but don't micromanage. We are all, I'm sure at some point, have been the person on the group team who was the only person working, and so you had to micromanage, otherwise the group project didn't get done. I see a few heads nodding. That doesn't work long-term for leadership. You really have to give people ownership over a project, even if how they carry it out is different from how you would do it. And then that ties back into clear communications and expectations. Give them a deadline and then trust that they'll make it. Be a role model in the quality of the work that you do. If you're getting things done last minute, if you're giving a half effort, that's all your team's going to give you as well. You really need to lead by example in the type of work that you're doing. And then creating a psychologically safe space for your team. Psychological safety is when you feel the freedom to be yourself without repercussions. And I think that the best way to do that is to be vulnerable and to admit your mistakes. One example of this is we were creating dot phrases for letters to mail out to our patients. And I put in there, for the anemia dot phrase. I said, take your iron with orange juice in the morning. And one of my fellow colleagues says, that's made up. And I was like, I looked into it because I didn't believe her. I was like, you're right. It is. That's my bad. We don't have to put that in there. But being willing to take ownership for your mistakes, I think shows it builds safety and trust, and it also builds an area for the people who you are leading to make mistakes and for that to be okay. Some skills of a successful leader, and these are things that you can be coached on a lot of time, and we'll get to that a little bit later as well. But strategic planning, deciding what the vision of what you're working towards is, consensus building, getting people on board with that vision. A lot of times, so much of leadership is interpersonal skills, and that's where things like empathy and curiosity play a big role. But conflict resolution is also a big interpersonal skill that you have to have. Not everybody is going to agree with you. Not everybody is going to agree with everybody else in your group. And how do you work through that to come to a solution? Financial decision making. Few leadership positions come without some sort of financial responsibility. And so making sure that you understand how to analyze the budget and plan for the upcoming quarter, fiscal year, what have you. And then prioritization, and we'll talk about that in just a second. I do want to point out there is a difference between managing and leading. Managers tend to have subordinates, whereas leaders have followers. So you're assigned a manager. You choose a leader. Managers will manage tasks, very specific and goal-oriented. Leaders do the right things. You pick the projects that are the right projects to take moving forward. Managers will often focus on tasks, whereas leaders focus on strategy. That's not to say there's not a ton of overlap. I do a lot of managing in my day-to-day, but I also do leading. And I think it's fair to look at a task that's in front of you and say, is this a task that needs managed, or is this a task that needs a leader? And as you can see, all of these are all intertwined. You can't have skills without actions, without characteristics that don't all intersect. And then I wanted to talk about the prioritization matrix. This was something I learned this is one of the skills of successful leaders. This was introduced to me during my internal medicine chief year, and I found it incredibly helpful in organizing my days and my weeks. If something is urgent and important, you need to be the one to do it, and you need to do it right now. This is the stuff where you say, I'm sorry, doors closed, important meeting, you're taking care of this. If something is urgent but not important, that is an excellent task to delegate. That is, hey, we need to accomplish this, and I need you to be the one to do it. Can you please have it to me in 2 days? If something is important but not urgent, that's something where you block time in your schedule and you don't let anything encroach on that. You say budget review and you block 2 hours, and that is all you are doing during that time. But you do need to carve out time for it. And then if something is not urgent and not important, for example, the survey that you got from, the ice cream shop you went to the other day, just delete the email, okay? Just delete it. And I think that's where we struggle because we try to be do-gooders, and so we're trying to do everything on our plate. Don't do that. Just delete it, okay? But if you can organize the task, your to-do list into these quadrants, you will find that you are able to apply your knowledge and expertise to the matters that most need it. And so this was life-changing for me. I hope it's the same for you. So what are some leadership styles? There's lots of different tests and strength finders and various things. We'll spend some time today with Sen Delaney and the 6 Goldman leadership styles. I mentioned the Clifton Strengths just because it's another one that's available as well. So Sen Delaney really is not a leadership style. It's more of a behavioral skills assessment, similar to, but slightly different from your Enneagrams or your Myers-Briggs. Sindolini is a culture building tool within organizations. And I like this behavioral style quiz that we'll do a little bit later, because our behavioral styles are our thoughts, our experiences, our culture, everything that feeds into how we view the world. And what we get on the other end of that is our actions and how we interact with others. And so we'll do this behavioral quiz later and kind of get grouped into these areas and see kind of what that means for our leadership style. The Clifton Strengths Finder, it's very similar to the Goleman 6 leadership style, so we'll spend more time with that one. But there's the executing, influencing, relationship building, and strategic thinking. And if you take the Strengths Finder, it gives you a major category and then your specific category down here. Executing are the people that like get things done. These are task-oriented people that like to accomplish things. Influencing, these are more of your visionaries. These are the ones that are like, I've got a great new direction to take this project. Relationship building, these are the ones that really build cohesiveness in a team, make people feel heard, really have strong empathy characteristics. And then strategic thinking, these people take information and let it inform their decision making. They're really data driven. So let's talk about the Goleman 6 leadership styles. Commanding is the do what I tell you. This may sound terrible, and I don't recommend it as a long-term leadership style, but it is really good in specific situations. For example, you are an ER physician and someone with sepsis has just hit your door. You need a commanding leadership style to make sure that they get their antibiotics within 3 hours to save their life. So that's not a time to be a visionary, right? It's time to have the commanding leadership style, give people the tools that they need, right? If you're the director of the ER, you need to make sure that antibiotics are easily accessible and stocked. You need to make sure that people know how to identify sepsis, and you need to make sure that everybody knows what their role is in that situation. But successful leaders will make sure that people have the tools to do what they need to do so that when the need arises for this leadership style, everybody is ready to go. The visionary is their tagline is come with me. And I really like that it's a picture of a mountain. I picture visionaries as like drawing out this like huge map on a whiteboard of like, this is where we could go in 5 years. And I'm going to equip you all to do that. And it really gives a lot of agency to the people that you're leading to carry out the vision. It's oftentimes really a good idea to use this style if you're coming in as a new leader to an organization, particularly any organization that has had maybe scandal in the past or team breakdown or has stalled out after a previous vision. This can be really energizing to an organization. Affiliative is people come first. These are the people that do a really good job of building culture. So this is where you remember people's birthdays because you put them in your phone, y'all. I just don't remember unless it's in my phone. So put people's birthdays in your phone and tell them happy birthday on their birthday. Take them out to coffee after they've had a bad day. We have one physician in our group that is excellent at developing her MAs, and after a hard day, she like buys them Chick-fil-A and they sit down and talk about it. Like, no wonder we love to have our MAs train under her. She is very good at putting people first. Democratic is what do you think? And this is great if you don't know what direction you want to go and you want buy-in from the people that you're leading. A lot of times, this is a very time-consuming way of doing it, and I will caution you, so women and minorities oftentimes don't speak up in large group settings, so making sure that you have the large group setting, but that you also have anonymous surveys and that you're available to meet one-on-one, and that you have email easily accessible to everybody so that everybody has an avenue that they're most comfortable with to make their voice heard. Because really and truly, you want every voice heard in this process. It is time consuming, but you have high buy-in from your people to carry out whatever vision is put forward. Pace setting is do as I do now. It and commanding are sort of the task-oriented leadership styles. The rest are more team focused. Again, pace setting is best used for short periods of time in crises. Think like COVID-19 pandemic, we need to set up drive-through testing. I'm going to be out there in my gear with my swabbing noses, and I expect you all to be out here too, because that's what we're doing in this organization. And so it's the one where you lead by example. It really is only sustainable for a short period of time because it's a very authoritarian approach. Coaching is sort of a try this. If one really good example of this that I have is the manager of our physical therapy department was getting a lot of referrals for pelvic floor physical therapy for our patients. And we were having to refer out to volunteers that were overloaded and unable to manage our wait list. And so what he did is he asked around his department to see if anyone would want to be trained in pelvic floor physical therapy. 2 people said yes. He made sure that they got the training. He made sure that they got the hours. And then, y'all, they demolished our wait list. Everybody got what they needed. And it was a really amazing example of developing his staff to take care of a need for our patient population. And he's better for it. The PTs are better for it. Our patients are better for it. That is amazing coaching leadership. And this is all of that information on a very complicated slide. I think maybe if y'all get access to these slides later, you can take a look through it. But one thing I want to point out is that this part right here, this resonant and dissonant, these look kind of negative if you read through them. But again, I don't think that they're negative leadership styles. I just think that they have a time and a place and a short duration. So there really isn't any one perfect leadership style. It's not, if you are a visionary leader, then you are the best kind of leader. That's not true. Each situation takes, and I apologize, y'all, I caught this mistake afterwards. Please forgive me. This is me owning up. But there is no one perfect leadership style. You really do need to adapt your leadership style to each new circumstance. Utilize your strengths and develop your weaknesses. Okay, so now, give me 1 second. As we've kind of looked through and talked about some of those leadership styles, I'd like for y'all to say what leadership strength or style most resonates with you. Visionary really resonates with me. We'll talk about the Cindelini stuff here in a minute, but I've had to develop my democratic one. You know, democratic involves giving control to other people. I struggle with that, but it's an important skill to develop. Right. I think this is awesome. And what this shows is that we all have different strengths and that we can develop these other areas. Oh, I like this. Maybe one person that's a coach. Great job. But I think coaching is important, and finding out where to apply that is also really important. Cool. So now we're going to do a little bit of work. We're going to work on developing your leadership style. Know your strengths and areas for improvement. Feedback, which we'll practice, is essential, both giving feedback to others and receiving feedback. Feedback is always a two-way street. And then practice, practice, practice. I used to, I'm of an age where we said practice makes perfect. And I said that to my son the other day, who's 7, he's in 2nd grade. He goes, Mom, practice makes permanent, not perfect. And I was like, that is really beautiful. So take that home with you. Practice makes permanent, not perfect. We're not aiming for perfection here. So go ahead and pull out uh, your Strengths Finder quiz, and go ahead and work through it for just a minute. And then as you finish up and are scoring yourself, I'll put this grid back up there so that you can kind of see where you fall in that. Okay, I see a few faces looking up. Um, I'll let y'all wrap up. And just let you know, I'm a promoter. I love big ideas. I love casting visions. I'm not always good at the nitty-gritty details. And so it's a good blind spot to be aware of because sometimes I do need to get into the nitty-gritty details. Again, this is not a leadership style. This is a behavioral style. But I feel like it's important to know because that affects how you lead. So we'll learn a little bit about these. So did everybody get a chance to find where you were on this grid? I can stay on here for a second longer. Okay, I'm seeing some heads nod. Because I feel like this is more helpful if you know where you fall on the grid before we talk about it. So controlling, it sounds terrible, doesn't it? I really wish they had come up with another name. But controlling are the people that are like, I'm going to get this done. Okay. These people are strong-willed, self-motivated, and results focused. They are very task-oriented. Um, they are direct oftentimes in dealing with people. And here in the South, we can say, they were just really abrupt. But that's just a cultural difference, okay? It's not a value judgment. They are decisive, concerned with efficiency. Now, with every strength, you have a challenge, and the challenges for these people are they can be impatient, they can come off as very demanding, insensitive to feelings, and unwilling to kind of let go. But in general, if you want something done, you want someone with a more controlling type personality to help with that. And I think these types of behavioral assessments can also be really helpful within your team, because if you know where people's strengths are, you can utilize them best in the area that fits best with their strengths. For the analyzing, these people tend to be very highly organized and data driven. They are conscientious, they logically think through things, um, and they like to set up systems and procedures. We have someone in our organization. She's actually, this is perfect for her. She's the head of our quality improvement department. And we recently took on a hypertension control initiative. And y'all, there was so much data, but there was also an incredible workflow outlined in how, if we identify someone with high blood pressure, well, what steps are we going to take next? When do they need to follow up with the doctor? When can they follow up for a nurse visit? How are we making sure we're getting accurate blood pressure control? She took on this project for our clinic, and y'all, our hypertension control rates have skyrocketed. It's been really amazing utilizing her skills. They tend to be problem solvers, thorough, accurate, reliable, and dependable, but they can be indecisive. They can be too detailed, too in the weeds, and a little bit over process oriented. Sometimes you just need to make a decision. You don't need a whole process for it. For promoters, these people tend to be energetic, adventurous, creative, persuasive. They like new and different challenges. They're really good at motivating and inspiring others. This one goes well with the visionary leadership style. They're big picture thinkers. They may avoid data and details. There may be lack of planning and follow through because they're like, look at this painting I've made over here. Look at this big idea I have. And they may do too much at once. If you can move from one big idea to one big idea without getting into the nitty gritty, yeah, you can see how that would happen. Supporting, these people tend to be relationship oriented. This goes really well with the relationship building leadership style. They are loyal, understanding, empathetic, cooperative, and flexible. They are good team builders and good people for conflict resolution. They also are often cause oriented. So if you can get them behind your cause, you really have a strong ally. Challenges, difficulty in saying no, and difficulty creating processes. They're often so focused on people and relationship that, dealing with conflict or, not dealing with conflict, but getting results done and getting the nitty gritty lined out is not their strength. And then feedback. Like I said earlier, feedback is a two-way street. And I've got to give a huge shout out to Dr. Desiree Burrows-Ray, who created this. And it has been so helpful for me. This is a feedback preparation grid. And this is about giving feedback, which we're going to practice because that's an important leadership skill. But you can also use it to elicit feedback from people. So the first part is to get a micro yes. It gets buy-in from the person that you're talking to, and it reduces the mystery about what are we going to be talking about. Example A is, hey, do you have 10 minutes to talk about that meeting we just had? They know that it's about the meeting. They know it's only going to be 10 minutes, and it's an easy yes. A data point. Here, you really want to focus on behavior and not the person or character traits of a person. You don't want to be blaming or shaming here. And you want to focus on data, not interpretation of the data. And you don't want it says don't blur words. I take that just to mean don't be vague. Be very specific. The more specific you are, the better. So I noticed when I proposed an idea, you said that'll never work. You didn't say, you were such a bully in that meeting, and it really hurt my feelings, which is probably what happened. But what you brought to the person is a data point. There's an impact statement. Why does it matter and who is affected by it? I mention it because I'm hesitant to share my thinking with you now. And then a question. Check to see if they saw it the same way. Is there something you guys can do together to problem solve? And then agree to an action plan. How do you see how that went? How might we get our ideas out best during meetings? And then there's example B. Can I share some thoughts with you on how we're working together? I noticed that in our last 3 one-on-ones, or that you canceled our last 3 one-on-ones and haven't replied to the questions I sent last week. I mention it because I'm thinking you don't find my work important. I might be totally wrong, but I don't want to keep my assumptions to myself. That's a hard conversation to have. But in this framework, it lays it out easily, and you can have that conversation then. What are your thoughts? How do you see it? So we're going to take a minute, and we are going to practice this. So I want you to turn to the person next to you. And I've got sort of 3 scenarios here. One is between Dr. Barry and a resident. One is between Dr. Nelson and Dr. Rash. And one is between Dr. Swans and a manager. Read through these, pick your favorite scenario, and then I'll flip back to the feedback preparation grid. And I want you each to take a turn, either requesting feedback or giving feedback. All right. Has everybody had a chance to pick their favorite scenario? Okay. Go ahead and talk to the person next to you for just a few minutes. All right, y'all, I'm going to bring you back. Sounds like there was some good discussion happening. I hope y'all find this feedback tool really helpful. I know that I have. And as you are, in your positions of leadership, it is really important, especially early on, to get that feedback, both from the people that you report to, but also the people reporting to you, because you may get feedback that, hey, you're doing this commanding leadership style a little too often. do you want to switch to something else? And not that they'll say it in those exact words, but it's helpful as you work to make adjustments in becoming a better leader. So next up, we're going to practice kind of picking and developing your leadership style to the situation. So I've got 3 examples up here, and we'll kind of we'll take them one by one, and I'll flip. I have this here so that y'all can look at it. But it's MLK weekend, and this will sound familiar, y'all. And Memphis gets hit with 5 inches of snow. You are the chief resident, and residents are calling, asking you what to do. What leadership styles do you think, and you can just talk to your neighbor, you can shout it out, but what leadership style do you think is needed here? Any brave soul want to shout out what they're discussing? So for me, this is a great time to do the commanding or the pace setting leadership style. Show up to the hospital and say, I know it's hard to get here. I've got 4-wheel drive. Can I pick you up? Or I know you got stuck in the hospital while this 5 inches got dumped. Here, I brought you dinner. Be willing to show up and lead by example, or commanding, say, I'm sorry. Sometimes it sucks that we have to be at the hospital at all hours, at all time of the day or night. But you know what's worse? It's worse to be the patient. You know, we've got to show up and be there for them. And that's part of the joy and the burden of this profession, you know, but really coming alongside of them and leading by example. Again, it's a short period of time, snow melts. All right, so the next scenario is you are the medical director of a large physician group that covers Regional 1. One of your staff has consistently poor performance for the past 6 months, and you have reviews from nursing, fellow physicians, and management. What type of leadership style do you need to employ here? Y'all can talk amongst yourselves. Okay, what did y'all come up with? Coaching is a great one. I also put affiliative. You may come to find out that, you know, their mom just got diagnosed with uterine cancer and they're elder in their church and their kids not performing well in school. There may be things going on you just don't understand until you show them that you care. And then coaching and saying, hey, look, I've got these data points. We're going to work on X, Y, and Z, and these are going to be the metrics by which we measure your improvement. So great. I think that's awesome. The third one is your hospital is wanting to undertake a new sepsis initiative due to a recent adverse event on a med-surg floor. What leadership style is needed? Anybody want to shout one out? I said democratic and visionary, which might seem at odds with one another, but if you know what needs to be done, say you've been reading the sepsis data, you've been looking what other hospital systems have been doing, and you know you have the right answer, great. Move forward with that. Cast the vision of what excellent control looks like. But if you're like, you know, I've been doing my reading and in the literature, it seems like there are 3 really good ways that we could go about this, then you might want to employ the democratic method and get buy-in from the people that will actually be carrying out the initiative. And then I want to talk a little bit about imposter syndrome. Um, I bring this up because it's incredibly common in medicine. I know you all have heard it before, uh, but it's especially common in leaders in medicine. Imposter syndrome is the persistent inability to believe that your success has been deserved or is legitimately achieved as a result of your own efforts and skills. It is particularly common for women and minorities, and it is very pervasive in medicine. Its implications include anxiety, depression, and physician burnout, things we're all familiar with. And I say it because you can guard against it, and I want to empower you to do so, whether you have felt this and you need to employ these now, or you want to guard yourself against this. These tools can be used. And one of the things that I think is really important about talking about imposter syndrome is that you go from being a physician to being a physician leader. You go from having this skill set that you've developed for the last, I don't know, 7 to 11 years. And now you're being asked to have a whole new skill set. There is gonna be uncertainty as you acquire those skills. And that's where I think imposter syndrome particularly can creep in. But if you accept your responsibility, act with integrity, and as Anna from Frozen would say, just do the next right thing, you will find that it gets easier and easier with time. So one of the things that you can do to protect against imposter syndrome is share your feelings. Typically, you want to choose somebody not in your profession, but it can be a counselor, a trusted friend, a partner. All of these are good ideas, but share your feelings because they're valid. Okay. Celebrate your successes. This is something that my amazing mentor, Dr. Chris Jackson, has taught me. He keeps a sunshine folder in his computer where he keeps emails that have brightened his day or feedback that was really positive about something. And when you're feeling down and like you're not accomplishing anything or feeling bad about yourself, you can go and open this sunshine folder and be reminded of the good work that you have done and the impact that you have made. How beautiful is that? And then share your failures. I think it's important too to understand that with imposter syndrome, you can get into this false narrative that you always have to have the right answers. And that's not true. And in fact, that worsens it. And so share your failures. Point out when you misspell adapt in the PowerPoint. It takes away the power that failure can have over you. And then let go of perfectionism. Don't lower your standards. I still want you to act with integrity, to lead with integrity, but understand and embrace ambiguity in situations too. I think we can do that really well in medicine. That's why we have differential diagnoses. We can lean into that gray area. And the more you can do that, the more you will let go of the one right way to do things. Good. That's all I wanted to say about that. And then some additional tools. We don't exist in silos. We need to create a group of people around us, encouraging us and helping us on our leadership journey. And one of the ways to do that is to have mentors, coaches, and sponsors. And we'll talk kind of briefly about what these mean. Coaches focus on specific skills and professional improvement. So this is typically a short-term relationship to address a specific need. I'll give you a funny example. I am a passionate person. I have strong feelings and strong convictions, and sometimes I reply to emails too quickly with that in mind. And so one of the things that I had to be coached on during my internal medicine chief year was how to compose a thoughtful, passionate email that is not offensive. Okay. And that was a hard one skill, y'all. But I had a coach who helped me and who I would like send my email to. They would read through it, give me corrections, and send it back. And through that process, I learned how to be passionate and hold my convictions while not being offensive. And I think that's it was an important skill that I learned, and I couldn't have done it without my coach. Mentors focus on the holistic personal and professional development. I mentioned that Dr. Chris Jackson is my mentor. He started being my mentor during my internal medicine chief year. Y'all, he still calls to ask, how am I doing? What's going on at work? What's going on at home? He cares about me and shows me kind of what the next right thing to do is. Mentors are often just a little bit ahead of you in the same career path and can guide you to success. Sponsors, they focus on advancement within a particular organization. So a sponsor is going to be within your own organization. It's kind of a high stakes relationship because they are going to really stick their neck out there for you. They're going to say, I think that, Dr. Smith over here really deserves to be promoted into this leadership position because of the work that I have done with them. They're going to risk their title, position, reputation to help you advance within an organization. Sometimes you can find the magical unicorn who is all three of these things. I'm sure they exist out there somewhere, but more often than not, it's going to be multiple people. And you can have multiple people doing that. You can have a coach for this and a coach for that. And you can have a coach to help you figure out how to budget. I needed one. And you may need multiple sponsors. So in our organization, our previous medical director, as she was stepping down, was saying, hey, I really think that, and I'm a co-medical director. I don't know if I said that, but one of my former co-residents and now colleagues, Dr. Joel Finley, is a co-medical director with me. And Dr. Nelson was fantastic about saying, hey, as I step down, I want these two people to be in this leadership position. And that she really kind of like put her reputation out there to put us up where we're at now. And then I like this little summary here. A coach talks to you, a mentor talks with you, and a sponsor talks about you. So I want you to, as we wrap up this talk, think about the people in your lives that can fit into these roles and then ask them. People want to help you. They want to see you succeed. And if you ask them, it can formalize that and move things forward. And this is just a little table summarizing everything I just said. Again, if you have these slides afterwards. And I liked these little things here at the bottom, that mentoring and sponsorship are both two-sided relationships and coaching tends to be a one-sided relationship. And these are my two beautiful children. That's Ward, he's 7, and Angeline, she's 5. And this is us in Colorado last summer. But I put it up here because I wanted to show you all my beautiful family and see if y'all have any questions. Okay, if you don't, you can also find me afterwards too. Okay. And here are my references. Thank y'all so much for your attention.